Hi Anna, it's good to see you.
Hi Fernand, I am happy to see you. I trust you are well.
Yes, thank you. Just sneezing and I have flu-like symptoms.
I'm sorry to hear that, but it's good that you are sneezing into your elbow, and we are in a ventilated area, otherwise we should actually wear our masks at all times and keep 1 to 2 meters distance. Social distancing they call it.
Yes, I feel a bit feverish, but I don't think it's anything other than the normal flu.
If you have the flu and you have COVID-19-like symptoms, then I suggest you consult your doctor virtually so that he can prescribe some medication or advise you to get tested for COVID-19.
Achoo, achoo, achoo.
Fernand, I think you need to consult the doctor. Take some vitamin C supplements, get some vitamin D from the sun, keep hydrated, and get a prescription for immune-boosting supplements and zinc. Keep warm and try to fast for at least 24 hours. I am not a doctor, but these suggestions should help you. Most importantly, pray, and contact your doctor.
I came to work today to share the verses on the 10 Commandments, and now you are asking me to go home.
Fernand, if you stay in the office, you might infect others. Also, you will only get worse. You need some bed rest.
I know that you are all scared that Elle might have COVID-19 and infect all of you. Can't someone just go through the flu in peace? What are the symptoms of this virus anyway?
Whether it is the flu or COVID-19, you need to self-quarantine so that you do not infect others. Again, I strongly suggest you consult your doctor or clinic virtually or over the phone first, and only go there if they ask you to. Do not forget to sanitize your hands and all surfaces. Spray your clothes, especially the elbows you sneezed into, with a liquid sanitizer, or slather soap over the area you sneezed and coughed into if you fear that the sanitizer might damage your clothes. You should immediately wash your clothes in, preferably, warm water and germ-killing washing powder.
Right. I'll put my clothes in the washing machine and ask the dry cleaners to collect my suit following all COVID-19 precautions.
Now, back to your question. According to the World Health Organization, the symptoms of COVID-19 are, and these are direct quotes from the World Health Organization's website. According to the World Health Organization, WHO 2021, coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. Fernand, you should cough into your elbow and not fist. I know it'll take some getting used to. Please wash and sanitize your hands before touching anything. Whatever you do, don't touch your face with unwashed hands. I will spray your hands with a sanitizer and get the office upkeep and sanitization team to sanitize all surfaces, doorknobs, floors and restrooms. As for you, my friend, you need to go home.
Okay, Anna. I will go home, but please finish reading on the symptoms and so on about this virus. I know I don't have the energy to look up all of that and to read it. I just want to sleep.
Okay Fernand, let me quickly read what the WHO site says about COVID-19, then you'll go straight home and we don't expect to see you for at least a week.
Achoo, achoo, achoo. Yes, Anna.
COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms are fever, dry cough, and tiredness. Less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and a rash on skin, or discoloration of fingers or toes. Serious symptoms are difficulty breathing or shortness of breath, chest pain or pressure, and loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show, however, it can take up to 14 days. Reference: WHO, 2021.
I don't think I have the virus because I have been taking all the necessary precautions like wearing a mask, sanitizing my hands and surfaces, not touching my face with unwashed or unsanitized hands. I also avoid crowded and unventilated spaces. I stopped attending any form of large gatherings including funerals and physically going to church. Only a quarter of the CGN staff are allowed in studios or the office at any given time. Most of us work remotely, and our temperatures are checked daily. Also, I have a wet, not dry, cough, and mild fever. However, I will call the doctor to get medical advice and a prescription. So what does WHO say about preventative measures? Prevention is better than cure. So, how do we avoid catching this or any other virus?
Right. I will read what WHO says regarding COVID-19 preventative measures. Again, I quote, the WHO site says, however, prevention is better than cure. The World Health Organization has listed the following preventative measures to prevent infection and to slow transmission of COVID-19. Do the following: wash your hands regularly with soap and water, or clean them with alcohol-based hand rub. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. Reference: WHO, 2021.
Great. Thanks, Anna. Let me quickly sanitize my hands before I head home.
Right. Get well soon.